I'm Dr. Len Kolstad. I've been practicing in Meriden for 35 years now. I've come to take care of many generations of families in the area. I have a patient who I operated on as a young man who had a tumor in his knee. Subsequently, his knee deteriorated, and 30 years later, I wound up replacing it. Well, in the interim, I had already replaced his grandmother's hip, and when he came back for his knee replacement, he was happy with his knee replacement, and a couple of years later I did his hip replacement. And then his mother had had a knee replaced elsewhere in the state, was not entirely happy with that one, and so is here to have her knee replaced by me now. So there's 3 generations in that group, and I have a lot of other families who I've done, brothers and sisters, and parents and children. Now, what we're doing differently now than we did before also is that we have kind of a multimodal strategy at getting people into the hospital, out of the hospital, home with their families, and functional a lot faster than we ever did before. And part of this is, number 1, patient expectations. Number 2, it's important to get the family on board. We used to routinely send patients to nursing homes for follow-up and rehab. We hardly ever do that anymore. Our statistics have changed dramatically. 2 years ago, we were putting 80% of patients in rehab, even young, healthy patients, and now we're putting about 20% of patients in rehab, and the rest of the patients were getting home. Now we have better ways of killing your pain, a higher expectation for you to mobilize. I do patients under a spinal anesthetic. When the spinal wears off in a couple of hours, I get them up and we have them walk down the hall on the day of surgery. And we have, in this last month, we've had 100% of our patients do that.